Let's dive into the discussions shaping the nation.
Minister, the government has repeatedly stated that it doesn't want to see a drip feed of information about the audit of hip surgeries at the three children's hospitals, but that is what we are getting. Any information about this scandal has had to be dragged out of this government. Yesterday, responding to me, the Taoiseach confirmed for the first time that he expects the audit to be finalised next week. Why did it take so long to provide this basic piece of information which families have been spending months trying to get? It also took until yesterday to reveal that more than 2,200 families have now received letters as a result of the audit. On Tuesday, the Taoiseach didn't even know the correct reason those letters had been sent. Minister, unnecessary and painful surgery on young children is absolutely horrific. The impacts of these surgeries can be hugely traumatic. Families are utterly devastated to find out that this has happened to their child. Parents who have contacted me do not know where to go to get their questions answered. At the very least, the government must address this now. Minister, the lack of basic information, the level of inaccurate information and the drip feed of information coming from government is not acceptable. Why is the government keeping families in the dark until the final audit is published? Minister, on foot of the draft audit, a number of measures have already been taken. More than 2,200 letters have been sent out to families. A multidisciplinary team of clinicians is already reviewing cases, and an action plan has been put in place. So a lot of things are happening in the background, but what we are not getting is upfront or complete information about it. And this is causing huge distress for families who are desperate for information. Minister, the entire process has been dealt with shambolically by the government. Families have been left in the dark, and this needs to end now. Minister, the Taoiseach told me yesterday he expects the audit to be finalised by the end of next week. Does this mean parents will have it in their hands next week? What day will they receive it? Can you outline the full list of recommendations that have already been put into place at Children's Health Ireland and CAPA as a result of the audit? And will the Minister for Health answer questions next week in the Dáil when the audit is finalised? And can you give me a commitment on that, Minister?
Thank you, Deputy. I don't think it's helpful for any of us to be discussing certain parts and certain elements without having the full facts. And I appreciate fully and agree with you that families want all of the facts, they want the information, and they don't want it piecemeal. They certainly don't want parts of an unpublished document being published elsewhere, not coming through the Minister, not having that direct engagement, be it with the Minister, with CHI, or with the other hospitals involved here. So the most important thing is that we can have this review completed, and yes, the information provided to me is that the Minister has been told she will have this next week. I don't have the exact day, but obviously next week, as soon as the Minister has it, as soon as she is able to engage with the families first and foremost, she will do that. She's only recently spent quite a number of hours in the Dáil, I think, answering questions, not just on this, but many other issues as well. So there's never been any doubt that the Minister does not want to engage, does not want to talk to families or indeed discuss this here in the Chamber. To go back to the basic facts here, as we have all outlined, there's not a single one of us here could even comprehend what it's like for a family to believe that their child, or to know that their child has had a surgery that they didn't need. As a mother of two young children, the very thoughts are terrifying, and I apply that, I think, to anybody who has children, grandchildren, nieces, nephews. So we all want to make sure we get to the bottom of this, that those who need any further clinical help or assistance, that they get that, but that above all, practices that have to change, that they change. And that's what's happening already. So while we need to ascertain the facts for the families involved here, that doesn't prevent us from starting work in looking at why were these practices carried out? How do we make sure any surgeries happening at the moment that they're not applying the same practices? And we know that change is taking place already. So any surgeries at the moment, there is a multidisciplinary team that sits down, that looks at the cases and then decides whether to go forward or not. So that's really important progress that's been made. In terms of the letters, I mean, it's really important that families have communication throughout all of this. While there is piecemeal information being put out there, and it was the Minister, my understanding, that asked for the correct figure to be put out there because it was increasing and decreasing and escalating. We now have that figure because it was asked to be put into the public domain. So that did alleviate some of the concerns around the increasing numbers overall. We have established helplines or email addresses for patients to ask queries. Just to read them out, you have ceo@childrenshealthireland.ie and Kappa Kids Inquiries at nohc.ie. These are dedicated email addresses that have been put in place for families to be able to communicate separate to the letters that they have received, which very clearly state if you haven't had engagement from your hospital, if you haven't had follow-up, if you haven't had that sort of engagement, be it in the last year or 15 years, we are going to engage with you and reach out to you. So there were a number of strands here, Deputy, and I appreciate that. It would be better if everything was happening at once. The review is looking at exactly what has happened here. Separately, we've given an element of information, or CHI has, to be able to engage with those families, just to make that communication at the very outset, as set out, is best practice. And thirdly then, work is already underway in our hospitals to make sure that anything that's happening now, any procedures that are in place, that the same practice wasn't being applied here. But of course, once this report is received, the first thing the Minister will do is reach out to the families and make sure that she can engage with them on the facts and the information as she has them.
Deputy O'Callaghan.
Minister, for parents and for families not to have information now that they're seeking is hugely distressing for them. It's the very least that they deserve and that they expect. And we know from some of the information that has been drip fed that some of the recommendations in the draft audit are being implemented. We know that at this stage. So why can't you share with us all of the recommendations in that draft audit? You're already working on implementing a number of them. Parents have found that out. We know that. So why not share all of them with us? Why withhold that at this stage when the government is working away on implementing recommendations, and yet you won't share with us and the families what those recommendations are? So I'm just asking you now, will you now share those recommendations that the government is working away on with the families and with the public?
Deputy, I can't be any clearer on this. The Minister does not have the report. She does not have recommendations. While elements have been published, and I would say unhelpfully published in online articles, the report has not been presented to the Minister. I think it stands to reason, while this work has been done, the hospital is not going to sit still and say, well, we'll wait for everything. They know that they need to change their practices. That's why they've put new multidisciplinary teams in place. They know that it's important to write out and to engage with the families as they've identified them, because those figures have been put out intentionally into the public domain to try and alleviate any concerns that they're escalating beyond anything that we would have thought. And that work is underway at the moment. But in terms of a concrete set of recommendations, it is simply not the case that the Minister has them, is working on them and won't tell anybody. The report has not been finalised and presented to the Minister, but once it has been, the Minister will first and foremost engage with families. She'll engage with Kappa, with CHI, and of course will engage with the Dáil to see what do we need to do now, what are the next steps, and certainly where there are recommendations and changes that need to be made in our hospitals in terms of procedures, in terms of patient and client engagement, that they can proceed and that they can start immediately.
Thank you, Minister.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.